When a person is injured, they feel like everything in their life is going to be impacted if they can't use their hand. So it's encouraging as a therapist to be able to help them through that process so that they can do whatever it is that they need to do.
Hand therapists are highly trained specialists in treating both operative and non-operative problems with the hand, elbow, and even the shoulder.
A certified hand therapist is either an occupational therapist or a physical therapist that has a minimum of 3 years experience, and during that 3 years they have at least 4,000 hours of direct hand therapy. And at that point in time they can sit for a certification exam to become a certified hand therapist. We do evaluations of a new person coming in with a new injury or just out of surgery. We make splints. We do a lot of splinting. We assess where they are in their function as far as range of motion and strength, and then create a treatment plan to get them back to their full level of function.
So it's really important for a hand therapist when they meet someone not to just look at them as their diagnosis, but what's hard for them and what do they want to do and what do they need to do that they're having trouble with. When we treat patients, we use a variety of modalities. We use our hands, we use therapeutic modalities like ultrasound, laser, heat modalities, cold modalities. We can do exercises to regain strength. We can do functional activities.
I tell patients often half of the outcome in terms of the prognosis and the functionality of their hand is going to be based on what I do surgically, and the other half is based on what they do with the hand therapist.
Your hands are super important in life. They're how we do everything other than walk, hop, skip, run, and jump, right? So they're how you get dressed, they're how you wash up, they're how you prepare your food, they're how you take care of your house, they're how you drive, they're how you maintain your independence.
When I do surgeries, I tell folks my surgery may be 30% of your ultimate outcome, but really 70% is you and the therapist. Because once you leave the operating room or leave my office, you have to do the exercises, you have to make the appointments. So it's important to have a therapist who's engaging that will keep somebody coming back.
Stiffness is very important, particularly post-operatively, and I think that a certified hand therapist has many tools and different things that they can offer to the patient to help prevent that stiffness and get a good result from the surgery. The hand therapist is also capable of making custom-made splints.
So we customize the splinting depending on what the need of the injury is and what the purpose of the splint will be. So if somebody needs to have it to help immobilize them, not allow them to move a joint, or if they need to have it to help them to do a task better. So we will customize that to meet that need.
Part of what therapists do is not only the functionality, but it's, no pun intended, it's really hand-holding. Like, it's to be able to relate to somebody.
What I love about working at Ortho Rhode Island is the team approach to patients.
We as hand surgeons love to have our hand therapists very nearby because we work almost every day with each other. They'll come down and talk to me about patients. I'll come up to them and talk to them about patients to check on their progress, check on issues or problems that arise. So having them in close proximity, I think, is almost essential to a successful treatment of anybody with a hand or elbow problem.
It's very important for me as a therapist to know exactly what happened in the operating room and how that procedure went, what the concerns are of the doctor, and then on the flip side of that, after I've worked with that patient and they're checking back in with the doctor, he understands where they are in their progress and where we're running into obstacles.
If I have a question about a patient, how they're doing, or maybe if I want something specific, it's a lot easier for me to speak to the therapist and get feedback from them, and vice versa, as opposed to if it was an off-site therapist.
The collaboration between the hand surgeon and the hand therapist is pivotal, and it's pivotal in the overall outcome of the patient, and patients know it. Patients who walk in this room know it.
The patients appreciate it. They love seeing Lori and I or Aaron and I talking, about their care in front of them, instead of having to wait to make another appointment and come back and find out, oh, we should have done this a week ago. So I feel that aspect of it is very unique here.
It's an integral part of everybody's life, no matter what you do, whether you're an artist or you're a mechanic or any type of work, your life is dependent on your hands. And it's just very rewarding to help people get back to their regular everyday activities and being able to do what they love.
Hand injuries impact everything. And to be able to be the person that shows a person how to adapt what they're doing and then assist them in getting back to their regular life and reclaiming their life is super, super fulfilling for me. I wouldn't do anything else. I love what I do, in case you can't tell.